Hello and welcome to Sip of Wellness, the podcast where we dive headfirst into the awesome world of healthcare and wellness. Stick around as we chat about all sorts of things, one sip at a time, and covering all the details that shape how we feel emotionally, mentally, and physically. We're joined by interviews with the experts, sharing facts that'll support you all the way and questions that'll make you think. So grab your favorite drink, find a comfy spot, and let's gulp down some wisdom that'll support you in your journey to a more balanced and vibrant life. I'm Rima, and today I'm honored to present Dr. Gowri Ramanathan. Pleasure to have you, Dr. Gowri, in the episode.
Thank you very much for having me, Rima.
Thank you. The pleasure is mine. So, Dr. Gowri, before we start, can you tell us all a little bit about your journey so far, what you've done in the UAE and before in the UK?
So I am currently a consultant obstetrician and gynecologist and a fetal medicine specialist at King's College Hospital in Dubai. I did my undergraduate training in Australia. And then I went to the UK to do my postgraduate training, and then I specialised in fetal medicine with the father of fetal medicine, Professor Kypros Nikolaides, in King's College Hospital in London. I've been in UAE for 17 years. 10
that's
years
a huge
in Abu
number.
Dhabi, and now 7 years in Dubai.
You were actually one of the bases or the basic foundations of King's in Dubai as well.
Yes. We opened the hospital a few years ago.
Pleasure having you with us in the episode.
Thank you very much.
Dr. Gowri, before we start, I hear a lot of questions from so many people recently in pregnancy about fetal medicine. Like, this is something that we've been hearing about a lot lately, and a lot of patients actually ask, what is fetal medicine specifically? How does it differ from regular obs and gynae, and how should it be integrated within the normal pregnancy journey for women?
So fetal medicine is basically carrying off the fetus before birth. Traditionally in obstetrics, we would look after mums and, by the way, sort of do certain assessments for babies. But now we look at the baby as an individual, as a person. Now, majority of what we do is diagnostic screening. So we use the ultrasound and we look for certain key things that we look for at different stages in your pregnancy. And those, essentially, the key scans that we do are the 11 to 14 week scan at the end of the first trimester. And that's more the chromosome, the genetic screening that we check for. And then we do the anomaly scan, which is at 20 weeks. And that's more the structural screen. Does the baby have a cleft lip? Is there any brain abnormality? Occasionally, we do the third trimester screening as well, what we call the growth scan. And that's essentially to look at placental function. So those are the sort of main scans that we do in fetal medicine. General obstetrics and how does it relate to fetal medicine? So if you had a high-risk pregnancy where there is a risk of something going wrong with the baby or the babies in twin pregnancies, they require specialist follow-up and management. But in a general obstetric population, you would essentially send your patients or get seen in fetal medicine at these key scans. So you'd be referred for screening of the fetus, for chromosomal genetic, for screening of any anomalies, or if there were any. And this is
for any pregnancy, basically?
For any single pregnancy.
Okay.
Single, multiple pregnancies, yes.
Okay.
Yes.
So if I were to ask you today, like, how does your day-to-day look like?
What is my... So I do general obstetrics and gynecology. And I do fetal medicine. So I have two cohorts of patients. I get referrals for these key scans that we talked about, or if there were any concerns with the baby on general radiology, ultrasound. And then I have my group of patients that I look after from viability or from the time they get pregnant. And I do deliveries as well. I also do gynecology, and that includes, certain gynecological surgical procedures. So I have very busy days.
I can only imagine.
Yes, but it's yeah. So those are the two sort of aspects that I cover.
As a fetal medicine specialist, what are the key things that you look for, basically, in any pregnancy? Like, let's talk about the 3 main things that you usually look for.
So it depends on which scan we're doing and what we are assessing. So, for example, at the 11 to 14 week scan, what am I particularly looking for? Number 1, how many babies there are. Number 2, is the dates of the pregnancy correct? Number 3, we check the neck measurement, the nuchal translucency. That is a measurement of the neck, and we plug that into a risk calculator.
In your day-to-day practice, you must have come across so many embarrassing things that people usually talk about, or some people find a bit challenging to talk about. Now, we have compiled a couple of questions that some people find a bit embarrassing to talk about. But I want to know from your experience, what are the things that people should usually ask about but don't actually ask about?
So I think, just top of my head, I can think of a couple of things. The first is, should I be eating for 2? A lot of people tend to overeat in pregnancy, and that the answer to that question is no, you don't. You eat just for yourself, and the organ that you've created called the pregnancy extracts whatever that is required from a mother's body. So eat completely normally. Another question is exercise. Can I continue exercise? Can I continue running? Can I continue with my weightlifting? The answer is yes, you can. A lot of people, again, stop. Of course, if you've developed complications, like you've had a little bit of bleeding or a bit of spotting, then you might be advised to sort of slow down that level of activity. But exercise is 100% a yes. Another more delicate question is, can we have intercourse? And the answer is, again, yes. There is nothing to say that you should not be engaging with any sexual activity in pregnancy, unless, again, you've developed certain complications. So those are the ones I think that people tend to want to ask about, but don't. And then you have the funny symptoms of pregnancies, like, my discharge has changed. Is that normal? Is that not normal? And the answer is yes, it's completely normal. So the pregnancy hormones that occur causes a whole lot of changes within your cervix, your vaginal mucosa, and the discharge does change.
Does that happen from the beginning of pregnancy, or does it happen
from the very beginning? So from the early stages of pregnancy. Obviously, your pregnancy hormones continue to increase. It gets more further along the pregnancy, but yes, in general it does.
So when does a woman have to consult back? Like, when does she have to flag something,
So a lot of people think that, is it the amniotic fluid that's coming out, or is it actually just the discharge, or is it my urine that's leaking? And sometimes it can be quite difficult to tell the difference. In general, we say a little bit is fine. A lot means we need to exclude the amniotic fluid or a rupture in the amniotic sac. Anything that is just simple, clear, increased discharge is fine. However, if you start developing symptoms like itchiness, or it smells a little bit different, or the color changes, then that might be an infection, in which case it's best to get it assessed. Urine liquid leakage, again, incontinence is pretty common in pregnancy.
And that's something that a lot of women don't really want to talk about that much, because they feel kind of pressured into not talking about this, for example, specifically incontinence.
It is embarrassing. It's embarrassing when you laugh and you cough in pregnancy and you start leaking. So yes, again, that is a common, again, pregnancy hormone related, where your sphincters are quite different in pregnancy. So yeah. one of those things. Again, we need to exclude an infection in the urine.
Okay.
So any other symptoms other than just leakage, we would need to make sure that there's no infection in the urine.
What about the hated hemorrhoids? Because a lot of people actually talk about how hemorrhoids were a part of their journey during pregnancy and lasted a bit after delivery.
Hemorrhoids are actually relatively common, and it occurs in pregnancy hormone related again. But your whole pelvic floor becomes a complete different pelvic floor.
Okay.
So things sort of are looser down in your pelvic area, and hence the risk of hemorrhoids. Majority, thankfully, are asymptomatic. We don't do anything. There are some that become quite symptomatic, for which we need to give some treatment.
When you say symptomatic, you mean pain or?
Pain.
Okay.
Pain, discomfort.
Okay.
Yeah, those are the sort of symptoms. With hemorrhoids, we just need to make sure as well there's no constipation, so that that can worsen hemorrhoids with straining. So the usual advice of high fiber diet, lots of fluids, fruit and vegetables, just to sort of reduce the risk of that happening.
So would body odor also fall under the same category of hormonal changes?
Excessive sweating, body odor. So again, pregnancy hormones, your glands are hyperactive and you get more sweating and hence increased body odor. Salivation, excessive salivation, belching, constipation, the whole gamut of wonderful symptoms of pregnancy.
Is there anything women can do about this, like to kind of decrease it or limit it?
Unfortunately, no. We can relieve the symptoms of it by giving some medication that is obviously safe in pregnancy. But majority of it is not. It's something that just, unfortunately, some people suffer worse than others. I mean, the whole nausea, vomiting in first trimester pregnancy, some people are bedbound. Recurrent admissions in the first trimester because of, vomiting and unable to tolerate anything orally. And sometimes even medication is a struggle to control the symptoms. But it's one of those things, I think.
At least, are these things reversible after delivery?
Oh, 100%.
Okay.
100%.
So once the hormones go back to normal, everything goes back to normal.
Not everything goes back to normal. So the pelvic floor, and it's so common question that I get asked in second pregnancies and more. Doctor, everything feels really low. Now, even if you've not had a vaginal birth, if you've had a cesarean section, your pelvic floor is completely different. So everything falls a little bit lower, and the sensation that the baby's going to come out, that's unfortunately a very common symptom of the long-lasting effects of pregnancy, if you like. Now, we can try and reduce that with quite intense pelvic floor exercises after your first baby. It does reduce the incidence of it in the second pregnancy, but a lot of women, as you can imagine, with a toddler at home,
it's going to be
don't
tricky.
have the ability and the commitment to do that. So what happens is, there's a risk of certain disorders, gynecological disorders like prolapses, in which case, again, there are lots of things that we can do about it and treatments that we can give to sort of strengthen and make it as close to possible as pre-pregnancy.
We always talk about how prevention is key. In these cases, is there anything that can be done to prevent these things from happening, or at least not prevent, but kind of lessen the impact of hemorrhoids, of belching, of snoring even, because we didn't really talk about snoring, but all of these things that kind of accompany the pregnancy journey but aren't really as pleasant as one would want.
I mean, belching typically is worse with certain foods. So just being aware and sort of trial and error of different foods and trying to avoid those certain foods. Constipation, again, lots of fluids, high fiber diets, and exercise does help with it.
Yeah.
So yeah, I mean the things that we can try and reduce the symptoms of for sure, but it all sort of comes into the healthy lifestyle equation. You know, you do be as healthy as you can, and that in itself will reduce the symptoms that you have.
What do you think the partner's role is in all of this?
Support.
Okay.
You know, I think the role of partners is particularly so after delivery, in the postpartum period, but antenatally, yes, it is. Let's go for a walk together. Let's, cook healthy stuff at home. Let's, do what. Do things together rather than having to feel that a woman is doing it all by herself.
Just to be a companion.
Yeah. Yes.
You've mentioned, Dr. Gowri, that itchiness, like having an itchy skin, might be a red flag that there might be an infection. But a lot of women actually suffer from itchiness all over their body, like even in their belly and their skin overall. Might that also be an infection, or is that normal when it comes to pregnancy?
So skin stretches quite a lot in pregnancy. The typical place where women feel itchiness is in the abdomen, and that's just purely stretching of the skin. Sometimes in the hip area as well. So yes, we can reduce that by making sure it's well moisturized, using certain bio oils to try and reduce the stretch marks, the dreaded stretch marks and itchiness in skin. There are, however, certain conditions that are alarming and in terms of itchiness. So typically palm and soles of feet itching is associated with a particular complication in pregnancy called obstetric cholestasis.
Dr. Gowri, I gotta ask, what do you feel has been a game changer in the field of obstetrics and gynecology?
So I think there's been a lot of amazing advances in obstetrics, in fetal medicine, in what I do, from the whole diagnostic therapeutic. But I think one thing that really does stand out, and I believe will move at a pace that AI is moving, is stem cells. I think the nature of the stem cells and the opportune time to collect it at birth in newborn babies, I believe that would be absolute routine practice in all pregnancies in the future because of its potential. And as you know, I don't know if you know, but stem cells are pluripotent cells, so they can change into anything they want to, and we can make them change into anything we want to. So currently being used actively in certain blood cancers for treatment. New field at the moment, just whole regenerative story, regenerative medicine in from the aesthetics to the bones and the joints and so I think as quickly as AI has taken off with our chat GPTs, I think stem cells will certainly be something that we can be using on a daily basis.
We've been hearing a lot about stem cells recently, but to people who don't really understand what stem cells are, like, can you share with us why we've been hearing a lot about them recently and why it's important for women, especially now, like you're pregnant women, why is it important for them during their pregnancy to actually think about stem cells?
The challenge from the stem cells introduction into the market is there have been very varied entries. So you have good governed, well-researched, well set up labs, and then you have these backstreet boys, right? So you can get stem cells from third world countries apparently for very cheap amounts of money. I was recently talking to a pediatric neurologist, and he said, well, some of the mothers and parents actually say, I can get some stem cells from a country. Is that going to help my child with autism? Is that going to help my kid with behavioral problems? It's that regulation. And when as a parent, when I hear positive and I hear negative, it's just like a Google review.
Yeah.
You get enough bad publicity about it, it stains the name of the product. So I think, unfortunately, that's what's happened with stem cells from a clinical perspective.
Yeah.
And that's what we've seen. But the more, I currently work with a particular company, and it's a very governed and a lot of investment into research and moving forward with stem cells. I think, that's where the future is. That's where we should be looking for and looking at in terms of trying to educate our patients as well.
Yeah. So why do you think exactly during pregnancy should women and men, like as parents, should they consider stem cells? Like not afterwards, not before pregnancy? Like why is it that specific journey where they have to exactly understand what stem cells do and why they should go for it?
At birth is the time to collect newborn stem cells.
Okay.
So there's two different sorts of stem cells. There's the blood or hemopoietic stem cells, and then there's a mesenchymal or the tissue stem cells from the cord that we can collect. Today used in sort of slightly different ways, but it's the blood and the newborn stem cells that is the time to collect. And once the baby's out, you've lost the opportunity to do that. So the importance of making people understand during the pregnancy, giving them time to think about it, research it, do whatever they need to do, and then making that decision at birth.
And how do you, in your practice, integrate that knowledge and that specific piece of advice into your day-to-day practice or day-to-day consultation with women?
So I speak to women in the third trimester, closer towards the time of delivery, again, in a very careful way, because some people are not really for it, or they can't afford it.
Yeah.
So I mention the concept of a stem cells. If they are interested, then I sort of point them towards the right direction of getting more information about it.
In our past episodes, we've had multiple people come and talk about stem cells, actually, and I've been reading a lot about the breakthroughs when it comes to stem cells. So hearing that it can actually be stored for years and years down the road, that is something that I think a lot of families actually look forward to. But from your perspective and expertise, how do you think it can revolutionize medicine or revolutionize obstetrics, the care of obstetrics or gynecology in general?
I think stem cells have huge potential in ovarian preservation. So, as you know, and in my practice, certainly, a third of my women are over 40.
Yeah.
Women are delaying childbirth, they're delaying getting married, careers first, and particularly in a country like Dubai or a city like Dubai. People talk about egg preservation. With stem cells, we halt the aging of ovaries and your eggs. So that's a potential for IVF as well. From a fetal medicine perspective, I see a lot of fetal aspects, a lot of high-risk pregnancies. I see type 1 diabetes. I see, things where there's a huge potential for stem cells in terms of how we treat things. Certain disorders in fetuses, fetal anemia.
Yeah.
Potentially.
Yeah.
I mean, if we could create cells that would attack antibodies, this is all hypothesis, but potential hypothesis on value. So from a fetal perspective, I am very passionate about the whole stem cells story.
Yeah, the potential that stem cells potentially hold are very vast. Dr. Gowri, today, when a woman finds out that she's pregnant, she's overwhelmed with so many different emotions. She's overwhelmed with feelings of joy and excitement, and there's always fear in the background. Joy and excitement because it's a new chapter, a new journey, new everything. But a lot of women have, not a lot, most of the women who are having their first pregnancy, they have so many questions. One of the first questions they usually ask their partners or parents, they don't know where to start from or what to start looking for. So for these pregnant women, for these ladies, what would your advice be on how to tackle their pregnancy journey from the beginning?
So there are few avenues. There's always an element of self-research. So you do your own reading on certain things in pregnancy. In the old days, there were pregnancy books, but with this generation, there's no more pregnancy books. But there's a lot online that you can find in terms of pregnancy and how to sort of gather. There are apps. There are apps that tell you what you need to be feeling at each point of time. Obviously, your doctor is also your point of call. So I always tell patients, get a list of questions and then come in and ask me those questions that you need to ask. There are certain support groups out there as well that people can reach out to. But generally, you're right. It's the mum said this or grandma said this or my uncle said this and you know that it's just it's a normal physiological event, pregnancy is. So you know, majority of us have been through it to be able to give that little bit of advice.
If we were to talk about what's normal or not normal, how would you define a normal pregnancy journey? Normal, I mean, in nothing alarming from a mother's perspective, not from scans, not from something that you can only see as medical professionals, like from the mother. When should she be alarmed when something is wrong? Like, what are the alarming, let's say, aspects of her pregnancy?
Honestly, I think your mindset is half your challenge in pregnancy. Pregnancy is a phenomenal change. It's a phenomenal change to you, your body, your mind, your whole. You change in every single aspect. Your view of yourself changes as you look in the mirror. You know, your mind. You could start getting palpitations, vivid dreams. Women have dreams of terrible dreams that obviously, again, are not necessarily talked about. Snoring, you know, these things, a whole lot of body changes. Now, you have to have mindset of it is what it is and I accept what it is. Because if you fight it, you struggle. You struggle. You know, and it's interesting watching people and getting into the whole sort of dynamics of it. But the people who feel that they need to know exactly what's going on really struggle. Really struggle. And the ones who are all very positive fly through it with a big smile. So I think there's nothing that should be alarming unless it's really, really bad. Vivid dreams, bad dreams. Don't really want to go through what the dream compositions are, but you know, those can be completely normal once in a while. But if something is happening on a recurring basis, if you're starting to cry on a daily basis, that's when you need to seek assistance or help. Otherwise, it's hopefully it'll just pass.
On the other hand, from a medical point of view, you can already tell most of the things. Like you can tell if it's a healthy pregnancy, you can tell if there's anything alarming from your scheduled scans, correct?
It's not so much the scans, but the whole screening. So even blood test. So we do screening for iron deficiency anemia, hypothyroidism. We screen for gestational diabetes. Towards the end, we screen for preeclampsia, which is high blood pressure in pregnancy. We check the urine. So that every single time you see a doctor in your scheduled visits, we're screening for something. So that's how we sort of pick up on obstetric complications in pregnancy.
Dr. Gowri, for a new mother, What are the things that you think a new mother should always ask for and know about? Someone who it's her first pregnancy, first trimester, she just found out she's pregnant. What are the things that she should start considering?
I mean, the obvious are the obvious. The first thing is folic acid.
Yeah.
Folic acid is one thing that has proven to reduce the risk of a certain fetal abnormality or group of fetal abnormalities called neural tube defects. So folic acid is a must. Other than that, there's nothing that is an absolute yes or no. Can I eat pineapples? Well, eat anything in moderation.
Okay.
There's certain things which increase the risk of certain infections, particularly. So we say raw fish or salmon, try and avoid it in early pregnancy in the first trimester. First trimester is the most crucial part.
Okay.
And why? Because it's what we call the period of embryogenesis. That's where everything is forming.
Yeah.
I mean, if you think of the whole concept of life, from a ball of cells, it becomes into different organs. So that's when all your organs form. So by 11 to 12 weeks, you're done. People who have cats, we tell them to be careful about cleaning the litter of cats, because if they're toxoplasmosis, again, a form of infection. If they're immune, that's fine. But if they're not immune, then they're at risk of developing.
Leave that to the partner. It's fine. They can clean the litter box.
Correct. I mean, what I usually do is I walk through the whole journey at the certain time. So I don't talk about birth and delivery in the first trimester. So I talk about first trimester stuff in the first trimester, which is chromosome screening and what have you. And then we get into the second trimester. I talk about gestational diabetes, the 20-week scan. And then in the third trimester, we start talking about all other things. And then maybe 32 weeks onwards, we start talking about labor and delivery. So you walk that journey with your obstetrician as well. Yeah.
One of the things actually that a lot of women talk about is the delivery process itself. A lot of patients do not want to go for a normal delivery, or they do not want to go for a vaginal delivery because of the fear of it. So where do you usually stand on that, on calming them so that they can enter the delivery process in a very calm and easy, flowing mindset?
I think the most important thing is to keep an open mind at the process of birth. Obviously, natural is the best. Having said that, we need to explain to women about the risks of natural birth. Because we sometimes see the repercussions of women who've had a natural birth in the most natural environment, for example, a water birth. But the consequence of the delivery needs to be explained. Now, the risk of all that is extremely small, but they need to understand that. Likewise, a cesarean section. A lot of people come in and say, yes, we don't want to deliver vaginally, we want to have a cesarean section. That's fine, but there are risks associated with that. So I think, as obstetricians, we're there to provide the information and to guide your choice in what is right for you in terms of your birth.
Beautiful. I'm sure you've had a lot of moments that really shaped your practice so far. If I ask you for two things that really come to mind, what shaped your practice so far in the past 17 years, actually? What are the key moments that come to mind?
I can tell you what shaped my career. Is my training with Professor Nicolaides at King's College Hospital. I think the passion he has. You should watch his Netflix program called The Surgeon's Cut.
I heard about it. Like, it's on my list to watch.
You should. Professor Nicolaides is the most passionate fetal medicine doctor I've ever met. He has changed the way I feel I practice because I once I put a scanner or the probe on a baby, I know that baby. Because you do so many and you see so many babies that just one look and you just know, what's going on. So I think Professor Nicolaides is one of my people who's made me who I am today. I think you improve every single time you have a challenging situation as a doctor. Every single time you see a stillbirth, every single time you have to deliver a baby that's not alive, every single time you grieve with a woman having a miscarriage, I think all that really does mold you to be a more sort of empathetic and compassionate doctor, and the joys, and every single time you celebrate the birth with a couple, I think that all that puts it all into, you know, what people call experience of in practice, right?
What is your advice for a pregnant woman who's going through that journey, for her to go through it in the most peaceful way possible?
I think we are so blessed in Dubai.
Yeah.
We have a physician-led service. I think finding a right doctor is actually quite important. Finding a right facility that you're comfortable with is quite important. Trusting the process is important. And I think overall it's a beautiful, enjoyable experience. Enjoy where the journey takes you, because it can go from one place to the other, just like birth can start as one and end up the other. And yeah, again, I work at King's College Hospital in Dubai, and I think we have a fantastic group of doctors that would be more than happy to look after women and take them through that pregnancy journey.
So how can people reach out to you?
You can get in touch in any way. So I've got an Instagram page, and I have you can call me.
Amazing. This has been really an informative topic and an informative podcast. Thank you so much, Dr. Gowri.
Thank you very much for having me.
Thank you. Is there anything else you would like to say? Anything else, like any final thoughts?
Amazing initiative, and thank you very much.
Thank you so much, Dr. Gowri.
Thank you.
Thank you so much for tuning in to our episode today. If you like our content, make sure to subscribe and make sure to like our content and follow us. Thank you, and see you next time.